Right now in Real Talk with Denver7 and CPR News, the usual winter surge of COVID-19 that many expected didn't really materialize.
There are about 70 people hospitalized with COVID right now. That is a lot less than prior winters, a lot less than the peaks of COVID.
A collective sigh of relief for many, but for those with long COVID, that relief has yet to come.
I wouldn't say, I fully recovered. There is still some brain fog 3 years later.
And now a new study is providing a clearer picture of what people with long COVID in Colorado are going through and how that information can help professionals offer better treatments.
Welcome to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm Colorado Public Radio's Fernando-Frescas. Each week, in a partnership between Denver7 and CPR, we have a real talk about issues impacting underrepresented people across Colorado and amplifying voices you may not always hear. 5 years ago, next month, COVID shut down not just Colorado, but the entire world.
And we begin tonight with that breaking news that coronavirus is now in Colorado.
We have 3 more confirmed positives.
On the third day this week of over 1,000 new positive cases in Colorado, Denver issued new restrictions to curb the virus.
Hancock just ordered restaurants and bars to shut down starting first thing Tuesday.
Limiting restaurants to just take out a delivery and banning gatherings of 50 people or more.
Masks must now be worn outdoors when you're with someone outside of your household.
Starting tonight, last call for alcohol is moving up to 11 p.m. instead of midnight, and gatherings of friends and neighbors are being limited to 10 people or fewer.
A lot's changed since then. Gone are masking mandates, stay-at-home orders, and daily COVID testing.
But long COVID is still affecting thousands of Coloradans. That's according to a new study from the University of Colorado Anschutz Medical Campus and the state.
The study shows between October 2021 and August 2022, there was a shift in what type of care patients opted for after a long COVID diagnosis. Researchers found those patients who received a long COVID diagnosis opted more for outpatient and specialist care versus visiting an emergency room or being admitted to the hospital, a move researchers say can help better determine the needs of those living with long COVID and also help lead to more treatment options.
To give us more a lay of the land view is CPR's health reporter John Daly. John, thanks for being here.
You bet. Thanks for having me.
So you were on the front lines covering COVID in the early days, talking with doctors and nurses and patients, and we didn't know what the heck it was, right? So how is it different now than way back when? Of course, we know that, but you've been on the ground for so many years.
Yeah, a lot has changed since then, and a lot has gotten better. And really that's due to a lot better understanding of the disease, a lot better treatments, a lot better care, and of course vaccines. Vaccines were a game changer with COVID-19. And I think it's really valuable to think back to what it was like in the early days, right? So there were 4 different times where we had hospitalizations that were above 850 people in the hospital. We peaked in December of, I believe it was 2020, at 1,800 Coloradans hospitalized with COVID-19. That's a lot of people, and it really strained the healthcare system big time, really pushed to the brink. And it's easy to forget that now, but that's how rough things were. The other thing I think it's worth remembering is that we lost 15,000 Coloradans in the pandemic. People are still dying of COVID-19, but not at the numbers that they were before. And 15,000 represents that's the greatest loss of life from one single thing in Colorado in 100 years since the last pandemic.
Wow, that is definitely an important perspective and really sad and scary to think about. You mentioned people are still dying from COVID-19. What is the current state of COVID in Colorado, John?
Well, if you look at the dashboard, we have a dashboard, there are about 70 people hospitalized with COVID right now. So that is a lot less than prior winters, a lot less than the peaks of COVID. And certainly anytime it gets below 100 people in Colorado, we're a state of nearly 6 million people. That is a major improvement from where things were a few years ago.
And you mentioned that dashboard. I didn't think that was even a thing anymore. I remember looking at that during the pandemic, like hourly, whenever they released those numbers, but that's still a thing.
Yeah, it is. It evolved into a respiratory dashboard, a viral respiratory dashboard, and now it covers COVID and flu and RSV. All 3 are there on the dashboard, so you can still check it out anytime and see what the trends are.
Is wastewater monitoring being utilized? Because I know at one point it certainly was, and there was talk about that fading away. Where does that stand?
Yes, wastewater is still happening. It's about 20 utilities that are tracking it, and they will track the flu and RSV and COVID-19, and they can sort of see what's going on in the community, the broader community, and see how things are trending based on that data.
As a reporter, do you find that tracking data adequate?
Yeah, I think so. I mean, I think it gives you a really good general picture of what's happening. I think we should also note that right now, the health agencies in this country federally are facing funding cuts, and that could affect our ability to monitor all this stuff. The avian flu is going on, and so the ability of health agencies to tell what's going on could change, but I think I would say right now that yes, we have a pretty good sense of what's going on here in Colorado because the researchers and the experts are tracking wastewater. They're tracking what's happening in hospitals. We have this dashboard that did not exist before the pandemic. So in some ways, we really have learned some things, and it's helping us.
John, I remember a time, I think it was a solid 2 years, where I did not cover a story that did not have a COVID tie.
Yeah.
And I know every journalist in town has that same story. And now slowly but surely we can go days without COVID making it into the newscast. Is there anything that we should be talking about or something that does deserve some continual coverage related to COVID-19?
Well, long COVID, certainly, and I'm really glad that you're continuing to cover that. The other thing that I think it's really important for people to understand is that COVID is still in the community. It's still circulating. If we had, some strain that popped up on the scene that got people really sick, it was transmitting more easily, or if it combined with some of these other viruses, that could be really bad. So we're in a lot better place, way better than we were before. But that doesn't mean it's gone, and that doesn't mean that we don't need to keep an eye on it.
All right, John Daly, CPR's health reporter. Thank you so much for being here for this Real Talk.
You're welcome. Thanks for having me.
Well, coming up next, the pandemic has waned somewhat, as we just heard. For many, it feels like a constant repeat of 2020, those with long COVID.
So we'll hear from a colleague of ours whose life changed dramatically after contracting COVID and how he's coping today. This is Real Talk with Denver7 and CPR News.
Welcome back to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Fernando-Frescas.
And I'm Denver7's Micah Smith. The COVID-19 pandemic has been reclassified the COVID-19 endemic, and the world seems to be moving on.
But some can't. Those with long COVID.
And the CDC says long COVID is defined as a chronic condition that occurs after an initial infection and is present for at least 3 months.
And long COVID can cause ongoing symptoms that last well past 3 months. Many are still experiencing the after effects of their illness years after their first infection.
So joining us now is my colleague from Denver7, a wonderful guy, and I'm so honored he's chosen to share his long COVID story with us, Oscar Contreras, a Denver7 digital producer. Welcome to Real Talk.
Thank you for having me.
Oscar, can you take us back to when this all started for you? When did you first test positive for COVID, and what were your immediate symptoms?
So I first tested positive for COVID on February 10th, 2022. My first symptoms were basically like flu-like symptoms, fever, body aches, tiredness, but you have to think of that and then magnify that times 10. You'll recall that, none of us had been previously exposed, obviously, to SARS-CoV-2, the coronavirus. So the effects of the infection were felt more acutely, I guess you could say. One of the things that surprised me about this go-around with encountering the virus is that besides the fever and the chills and the sore throat and the tiredness and the dizziness that you might feel from flu, I felt migraine like I've never felt before. I felt like somebody was hitting me on the skull with a jackhammer. It really was like very strong migraine that lasted for days. I stayed positive for 11 days with COVID that first time.
First time, so you've had multiple iterations of COVID since then?
Yeah, actually 9 months after the first infection, people said if you get it once, you're going to be good to go. At the time, it was not known that you could get reinfected. lo and behold, people started
We now know, right?
We now know that reinfections are possible, right? So 9 months, and it was after the Halloween weekend that year in 2022, I tested positive again, unfortunately, because work exposure brought in the virus, and my body was not able to fight that off.
I mean, in terms of having COVID, you recovered from COVID. When did you start noticing like the symptoms weren't just going away, but becoming more of a permanent thing?
So I would say around April, May. So maybe 2 or 3 months after I had, passed through the acute phase of the infection, I started noticing that writing became really difficult. At Denver7, I am in charge of writing the news online, a report for online digital media. And so writing news stories, news releases, which generally take 5-10 minutes, took 30-40 minutes. I couldn't, there was a wall in my brain, you could say, where I had the thoughts that just couldn't come out from my brain into the keyboard, basically. And that was, I think, when I started realizing that there was something else going on.
Are any of those symptoms sticking around today? Like after the initial 3 months, you really started to have this intense brain fog. I know you said you had migraines at some point. What are you feeling today?
So there's still some brain fog 3 years later. It's not as severe, I would say, as it was at the beginning. But it's still there. There's some days, some weeks where I'm like, I don't know what I'm thinking. I can't express exactly my thoughts. I forget some things, and I have a very good memory. But sometimes I'll forget something, or I'll do something that I'm like, wait, why did I do that? And that's not the only symptom I have. I have also like chest pain that I went to the doctors for, and nobody could tell me what that was. So I was like, well, okay. And just with time, that has ebbed, I guess. I wouldn't say, I fully recovered. I think you'll find a lot of people with long COVID say they've adopted a new baseline for what their health is like now.
And you mentioned, talking to medical providers. What have they been doing, and have you responded to any treatment they provided? How has that played out with medical professionals?
So when I first was positive for COVID, I didn't know what long COVID was. I even though there was already, by that point, a lot of people were saying, we have long COVID. I'm like, what's that? And so it never occurred to me to associate my infection with any sort of long COVID symptoms. And so I started getting educated and asking questions in forums and, internet boards and all that kind of stuff. And, going through the doctors, they told me, well, you do appear to have some sort of heart condition, but your tests come back normal. PET scans, MRI scans, all those type of brain scans are like, we see nothing wrong with you, even though internally, and I know myself, I take care of myself as much as I can, even before the pandemic. And so I know how I respond to stress. I know how I respond to anxiety. A doctor once told me it could be anxiety. I'm like, this is not anxiety. I know how I respond to anxiety, and this is not it. So it was very hard to find and find someone who would be able to guide me through what was going on, and I never ultimately could.
Oscar, for our listeners, I just want them to know you are wearing a mask. Is there still a level of fear that exists for you of reinfection? Is that why you wear your mask?
I wouldn't say fear. I would say precaution, because, when you go out and drive and you put on your seatbelt, you're not fearful that you're going to get into a crash. When you go sleep at night and you lock your doors, you're not fearful that somebody's going to break in and kill you. When you're eating, cooking meat or whatever, you're not going to eat it raw because you're, fearful. You're just taking a precaution not to cause something that could harm you. So I'm not fearful. I would say I'm more just cautious, given that one infection caused a great deal of damage to my brain, and a second infection prolonged that and possibly caused other issues that are still now trying to resolve.
And Oscar, what can we do? People who love you, society, What can we do for you and other people with long COVID to better support this journey?
I think people, I think it goes beyond people. I think it's more of a systemic issue rather than not, right? So I think it needs to start with government, with public health officials. We now hear whenever someone gets sick with COVID or whatever, they'll say, oh, he's recovering, mild symptoms or whatever, but they're not really informing the public about the long-term effects that this condition can have, right? So there's not enough education about the damage that COVID can cause. It's a virus that infects nearly every organ of the body because it, infects the blood vessels. So if your blood vessels are infected, it's your heart, your brain, your kidneys, your lungs, your reproductive system. I would say, for people on a society level is try to talk to others. If you see someone with a mask, be kind, and just say, "Are you? Do you have long COVID? Start a conversation. What can I do? Do you need me to, wear a mask, get tested? Stuff like that. I think would help."
Yeah. Oscar Contreras, thank you so much for joining us for this Real Talk.
Thank you very much for having me.
And as Oscar said, the road to recovery is tough when you have long COVID, but there are doctors that are working hard to find therapies and cures.
Up next, we'll talk to a doctor who's at the forefront of long COVID research and treatment and determined to help those dealing with long COVID as they heal. This is Real Talk with Denver7 and CPR News. Welcome back to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Fernando-Frescas.
And I'm Denver7's Micah Smith. COVID's classification has changed, but for those living with long COVID, the struggle is far from over.
Yeah, joining us now is Dr. Sarah Jolly, director of the post-COVID clinic at UC Health, the University of Colorado Anschutz Medical Campus. Dr. Jolly, thanks so much for being here for this Real Talk.
Thanks for having me.
So you're the medical director of this post-COVID clinic. What is it? When did it start? Kind of give us that background there.
Yeah, our clinic is a multidisciplinary care clinic for patients with long COVID. We actually started pretty early in the pandemic, around April of 2020, as we started to see patients with longer-term symptoms after COVID. Our clinic brings providers together across disciplines, including pulmonary medicine, cardiology, physical medicine and rehabilitation, physical occupational therapy, to really kind of focus on the multi-system effects of COVID, because we know that patients can present with such different experiences and have so many symptoms involved.
Wow. How many people do doctors believe are suffering from long COVID, and what are the range of symptoms that you're seeing?
The current estimates are anywhere between 8 and 10% of Americans are experiencing long COVID symptoms. And there are over 200 symptoms that have been attributed to long COVID. I would say the most common symptoms that we see patients experiencing are long-term fatigue, brain fog, which you heard about, long-term heart effects, including palpitations, shortness of breath, cough.
Yeah. And I just want to go back to the fact you were starting this clinic well before antiviral medication, well before vaccines. You knew this was coming, and you knew that there were people that needed help. Talk me through that, saying we're going to stand up something now in 2020.
Yeah, and I think it was really driven by healthcare providers that we were seeing who were experiencing long-term symptoms and reaching out and saying, I'm not sure what these are coming from. I need some help. I'm struggling to get back to who I was. And so we started to pull providers together, and that has evolved over time as we've learned more about the different effects and symptoms and brought on different specialties as we've learned.
When I hear you say over 200 symptoms, my eyes got really big because that is such a wide range of symptoms. With that in mind, what treatments are available? I would assume there's a multitude. There's not a blanket treatment, but what are you seeing working in treating some of these symptoms?
And so currently the treatments are really symptom directed based on what individual symptom clusters are. For example, for some of the heart issues, there can be palpitations, there could be medicines to help bring down the heart rate to treat that. In terms of the fatigue, there are some medicines that can help with wakefulness, with the fatigue, to help improve some of those symptoms. Same with the brain fog. And then there's a lot of rehabilitation strategies that can be helpful to help patients adapt and lessen their symptom severity over time. We are also luckily in a phase of doing clinical trials where we have therapies that are starting to be targeted at the mechanisms of long COVID, things like persistence of virus, immune dysregulation, and we will hopefully have those trials coming out with results in the next 6 to 12 months, which will really advance our therapies.
What is the prognosis here for people with long COVID? I mean, is there a chance that they might recover from all of those symptoms? Or is, like we heard, the new baseline is this? Is that kind of all you can hope for these days?
Yeah, and I think, again, it's very variable by patient and what they're experiencing and the severity of their symptoms. We have had patients recover fully from long COVID, and then we have many patients, as we heard from Oscar, where their baseline is a different baseline. And we have had some patients that unfortunately have continued to experience really severe, debilitating, life-changing effects.
Are people with long COVID more susceptible to other illnesses like the flu or RSV? Because I have anecdotally just been hearing in my own circle, oh, I got COVID again and I have the flu.
Yeah, so we don't fully understand the effect of COVID on the immune system sensitivity to other infections. We do know that if patients have long COVID, if they get reinfection with COVID or any other virus, actually, that they can have recurrence of their symptoms. And so patients who have had COVID, if they get influenza, for example, can have worsening of their symptoms around the time of that infection as well.
5 years in, how are you feeling about COVID and how medical science is or is not advancing?
Yeah, I actually think we have learned a ton in 5 years, more than I think we expect for biomedical science, in part because of the response that has been and the attention that's been put to long COVID. We've learned a lot about the foundational biology, and that biology is now actually helping us to do clinical trials with targeted therapies to be able to hopefully really improve the lives of patients with long COVID. We certainly have much more to learn, but I think we've learned a lot in 4 years.
And we are so, so grateful for your work, for your team's work. I mean, this is just, it's such a good reminder that this isn't over for so many. And I'm just so appreciative of the medical community for their continued fight. If someone is watching or listening and they've recently had COVID and it just isn't getting better, what should they do? Who should they talk to?
I think it's always good to start with your primary care provider. I think if you're having ongoing symptoms, they can always refer you to a long COVID clinic. We're also doing a lot across the state to help primary care providers understand long COVID more so that patients can hopefully get treatment in their home communities as well.
Dr. Jolly, thanks so much for being here.
Thank you.
Dr. Sarah Jolly, the director of the post-COVID clinic at UC Health, the University of Colorado Anschutz Medical Campus.
Doing such important work.
Yes.
Well, that is this week's episode of Real Talk with Denver7 and CPR News. Every week, we have a Real Talk on issues that impact underrepresented people across Colorado.
You can find all of our shows online at denver7.com/realtalk or at cpr.org/realtalk. Have a great day.